Hi everyone, this is Dr. Demchenko, and today we'll discuss a very common issue, lower back pain. If your lower back hurts at the very bottom and only on one side, then most often this is pain in the area of the sacroiliac joint. This is not pain in the lumbar spine where there are vertebrae, but between the sacrum and the iliac bone. The following symptoms are very characteristic of these pains. First, the pain does not rise above the line between the sacrum and the fifth lumbar vertebra. Second, the pain is localized to only the right or left side of the body, mainly stays in the area of the sacroiliac joint and does not cross the midline. Third, the pain can go into the leg, but it never radiates below the knee joint. Fourth, the pain is most often associated with vertical positions or with the transition from a sitting position to a standing position. Quite often this pain subsides and disappears when you lie down or sit. Additionally, you can perform a backward bend test to reproduce the pain in the sacroiliac joint area. To do this, put your hands on your buttocks and bend backwards. Usually the pain will be reproduced directly in the area of the joint projection. Most often, the cause of sacroiliac joint blockage is the difference in tone of the gluteal muscles on both sides and one-sided rotation of the pelvis forward. The right or left part of the pelvis seems to rotate relative to the sacrum and the second part of the pelvis slightly forward, thereby blocking the sacroiliac joint. Therefore, the exercises that we will do today will be aimed at balancing the pelvic muscles and restoring the position of the pelvic bones.
Let's go!
In the first exercise, we will perform pelvic decompression and balance the leading muscles. For this, we will need a yoga brick or a book. Set the yoga brick lengthwise between your legs. Put your toes together. The angle in your knees should be 90 degrees. Next, perform a powerful compression of the cube for 10 seconds. Very often you can hear a fairly intense click in the area of the sacrum. This is normal and corresponds to the decompression of the lobar synapse. After 10 seconds of pressure, relax. Perform this procedure 5 times. We tense up, count to 10, exhale, relax. We tense up again, count to 10, relax. Repeat 5 times. Next, turn the cube to the narrow side. With such a cube setup, other muscles are engaged. And again, perform 2 to 3 cycles of tension and relaxation. The next exercise is performed only from the side of the pain. For this, grab your leg from the side of the pain with your hands and pull it past your shoulder. The most important thing is to introduce the very end of the amplitude. Do this exercise with a slight pullback. At the end, hold for 1 to 2 seconds. Repeat it 15 times. You can also compare this exercise with the other side. Usually it's much easier to lift up to the edge of the amplitude with the other leg. We need to do this from the side of pain, and most likely we will feel some limitation of movement at the end of the amplitude. If you felt sharp pain in the hip area while performing this exercise, skip it because it means that you have a blockage in the sacroiliac joint area. Also, when performing this exercise, make sure that the other leg does not lift off. You can ask someone to hold your leg while performing this exercise. Also, you can ask an assistant to press down on your leg from above to achieve a better stretch in this exercise. Repeat the exercise no less than 15 movements. We need this exercise to bring that wing that went forward back into the rear position. Therefore, do not perform this exercise from the other side. For the next exercise, we will need some kind of stick, for example, from a swab. Slide the stick between your legs so that it is as close to the knee joint as possible. Lift your legs to 90 degrees and hold the stick firmly with your hands. Then press with your legs so that a scissor effect is achieved. Maintain the tension for 10 seconds with subsequent relaxation. Repeat the procedure 5 times. After this, switch the legs and press again. Hold for 10 seconds with subsequent relaxation. This exercise very well balances the tone of the pelvic muscles from both sides. The next exercise is also performed asymmetrically, only on the side of the pain. Let's assume that this is the left side in my case. Grab your right leg with your hands and pull your hands in such a way to form a triangle for body stabilization and a bent leg. Place your left leg or the sick leg closer to the buttocks and pulling your hands, lift the pelvis upwards. Next, we slowly lower the pelvis down, slightly touching the surface, not relaxing, and again we go up. We reach the maximum point upwards, hold it for 1-2 seconds, and again slowly go down, touching the surface, not relaxing, and again we go up. Repeat the procedure 5 times. If it's easy for you, you can do it 10 times. Then we stay fixed for 30 seconds at the maximum point upwards. An additional exercise can also be with relaxation and stretching of the muscles. From the video about the sacroiliac joint, perform these exercises twice a day for 2 to 3 weeks. Then the pain will not only go away, but the results will be fixed. If these exercises helped you, like the video, write your questions in the comments and come for a personal appointment to the Dinamica clinic. All the best!